Okay, well, hello, my name is Dr. Eric Hollander, and I'm with the Spectrum Neuroscience and Treatment Institute in New York, as well as Albert Einstein College of Medicine. And we're hosting the International College of Obsessive Compulsive Spectrum Disorders this week in New York City. We have a number of international experts in OCD and related conditions. And we're very fortunate today to have Professor Naomi Fineberg, who comes to us from UK, where she runs the National Health Service program for treatment-resistant obsessive compulsive disorder. She trained at University of Cambridge and is with the University of Hertfordshire. And I thought that we would talk a little bit about obsessive compulsive personality disorder, where people don't really have a good understanding of that and how it differs from obsessive compulsive disorder itself and what are some of the characteristics. And I know that you've also done a great deal of research looking at neurocognitive difficulties in people with OCD and obsessive compulsive personality disorder. So maybe we can start by just tell us a little about obsessive compulsive personality disorder. What is that?
Well, thank you for inviting me, Eric. And you're absolutely right. There is a great deal of confusion between obsessive compulsive disorder and obsessive compulsive personality disorder. So I'm delighted to be able to talk a little bit about the personality disorder and try and tease apart the differences with obsessive compulsive disorder. Personality disorders in general are thought to represent pervasive problems with character and behaviour that start early in life and produce all sorts of difficulties, interpersonal and social difficulties for people. In the case of obsessive compulsive personality disorder, there's a pathological focus on orderliness, perfectionism, need for control, a focus on detail, and a difficulty with change at the expense of openness, flexibility, and efficiency, which really gets in the way of people functioning and getting on with their lives. The difference between obsessive compulsive personality disorder and OCD is that whereas people with OCD get involved in various ritualistic behaviours and have intrusive thoughts that they recognise as being senseless, be they checking or washing rituals or needing to get things right, in the case of the obsessive compulsive personality, the person really has a set of values and a sense of self that makes them feel that there is rationale for doing these behaviours. So they feel these behaviours are really very important. So they don't necessarily recognise them as being alien to them. Yet, by the same token, they're terrifically time-consuming. They result in slowness, they inhibit people, and people with this disorder come across as being inflexible, rigid, and difficult to work or live with.
Now, what usually brings people with obsessive compulsive personality disorder into treatment? Why do they come into treatment?
Very often they come into treatment because they become unwell in some other way. A large proportion of people with personality disorder, about 70%, get depression. They also suffer with anxiety disorders. They suffer with obsessive compulsive disorder as well. And it's often these perhaps secondary conditions that bring them into treatment. But you know, it's really interesting that when you look in primary care and counselling, people with obsessive compulsive personality disorder are the commonest kind of personality disorder in that kind, receiving treatment for mental problems. I think it's rarely recognised as being the primary problem. It's the secondary comorbidity that brings people into treatment.
Now, are these individuals difficult to live with, or are they hard to work with?
There are huge adaptive advantages in being meticulous and conscientious and workaholic, but there are also negative points. People feel a need to complete work before they can move on, so this really slows them down. They find unpredictable change very difficult, and they may get irritable and anxious and even come across as aggressive if they're challenged in that way. So they do come across as being judgmental, irritable, lacking a sense of humour, and inflexible. So whereas there are advantages in having these personality traits, if you have the full disorder, once it becomes more severe, it's actually very difficult to live with and to live with somebody with those problems.
So do they have a higher rate of divorce, for example, or do they frequently have difficulty on their jobs?
There's a high celibacy rate, and people have difficulty staying in work. People have difficulty with their marital relationships. Yeah.
And this sort of rigid, perfectionistic pattern, I mean, does it start very early in life?
Starts early, present by adolescence, rather like OCD and the other obsessive compulsive spectrum disorders, and generally runs a lifelong course. Though it may possibly be amenable to treatments, but as you pointed out, people with this disorder, despite the fact that it's really quite common, very rarely come for treatment for that disorder. There have been very, very few treatment studies looking at pure obsessive personality disorder. It's usually treated together with some other disorder. We don't have a great deal of data on it.
Now, do people with obsessive compulsive personality disorder, do they have obsessions or compulsions?
Well, not strictly defined if you require the obsessions and compulsions, as I said, to have this ego dystonic, this alien quality, but they have intrusive doubts, they have intrusive thoughts, they have repetitive checking, repeating behaviours, needing to get things absolutely correct. So if you broaden the concept of compulsions and obsessions, they do have disabling repetitive thinking and behaviour patterns that are disabling.
Now, are there features of obsessive compulsive personality disorder present in other disorders? For example, people with Asperger's syndrome? Is it similar to the rigidity that you might find in that condition?
I think the phenomenological evidence that we have suggests that the difficulties that people with Asperger's in managing sudden and unpredictable change is very similar on the face of it to the difficulties that people with obsessive compulsive personality face. I think would be great value in trying to probe that domain and look at the similarities and differences. As far as I'm aware, nobody's actually done a head-to-head comparison on those two groups.
How about the issues of morality and scrupulousness? Is that characteristic of these individuals?
Yes, hyper-judgmental, hyper-moral, and that may talk to this need for completeness and perfection. That everything has to be perfect, oneself has to be perfect, and one judges others as needing to be perfect too. That there's a feeling of discomfort in the presence of incompleteness and imperfection, which drives the need for perfection.
So how do you treat people with obsessive compulsive personality disorder?
Well, there are various approaches you could use. There's interest in psychological techniques such as cognitive remediation therapy, which tries to target this focus on detail, a sort of information processing problem where people tend to look at the detail rather than the whole picture, and try and help people expand one's horizons by encouraging that and motivating them to deal with change and to get used to change. And that involves training exercises. The other form of treatment could be using a drug treatment commonly used for obsessive compulsive disorder, a selective serotonin reuptake inhibitor. And there's some data suggesting, in my experience, patients can become more flexible, less anxious, less rigid when treated with an SSRI.
Now, can you describe the neurocognitive impairment that's sort of characteristic of both obsessive compulsive personality disorder and also obsessive compulsive disorder?
Well, as I mentioned, there haven't been many studies in the disorder as a pure form, but the studies that have been done, and we've just recently completed a study, show some of the similar abnormalities in obsessive compulsive personality disorder that you see in obsessive compulsive disorder, namely difficulty shifting attentional set. So this is a difficulty with cognitive flexibility. People will focus on a particular stimulus and then have great difficulty shifting their attention to something new when prompted to do so. They'd rather stick with the same thing. And I think that really talks to the clinical problems that they show. It's hard for them to multitask, it's hard for them to move on, they get stuck on the same theme. Similarly, they show cognitive slowness on an executive planning task. They think longer about it before they make a move. And that's, again, something that this task is also impaired in people with OCD, so I think that shows an area of congruence. But there's also some rather new data suggesting that people with OCD actually have stronger persistence than people with OCD, and that may be an area of divergence, that they will persist for longer without reward.
Can that persistence be advantageous?
I suppose it's context dependent, but if you continue to live a life despite reward, it might lead to a very impoverished impoverished existence.
Okay. So what are 3 points that you'd like to sort of emphasize to our viewers? What do you think is important in terms of a take-home message?
I think the take-home message is that obsessive compulsive personality disorder is common, it's easily confused with OCPD, it's likely to be treatable, and it's associated with a great deal of distress and disability and needs to be better researched.
Okay. Anything else that you'd like to highlight or cover, or?
No.
Okay. Well, thanks very much for visiting with us in New York, and looking forward to the International College of Obsessive Compulsive Spectrum Disorder Conference.
Thank you very much for inviting me. My pleasure.